Again, let's start over. Do we have any public comments? Do we have any public comments? Do we have any public comments? Hearing, excuse me. Hearing none, we'll move on to acknowledge the minutes from October 2nd. Is that it? October 3rd?
Yeah.
We have a motion and a second to acknowledge the second and third minutes. All those in favor signify by saying aye.
Aye.
Motion passed. Meet with the county engineer. Morning, Dwayne. Good haircut.
I got them all cut. And then my wife looked at me and she says, I cut it way too short. So I always tell
Seeing
her,
as it'll grow.
I always tell her she's the one that has to look at me. So she cuts it. I tell her to cut it however she wants to see it.
Oh,
Because
dear.
I really don't care. Last week, we finally got our flat cars set on Iris Avenue. After all of the arrangements with ITC shutting the power line, high voltage power lines down and getting everything set up. They started at 9 o'clock and were done before noon. It worked out very slick. The crane crew is very professional and skilled, and our guys did a great job of working on the ground floor to get everything in place. So the next couple of weeks, we'll work on welding plates to connect the 3 flat cars together and making sure we've got everything shimmed and set correctly. And hopefully here before the snow flies, we'll have everything 100% done. We've got the bridge railings and guardrails ordered. So yeah, I'm really excited that we'll have that thing open here before winter.
You know, at this rate, you could get snow by the weekend.
Bite your tongue, lady.
Gotta have frost first.
This week or today, the crews are out cleaning up the loose gravel, the loose chips on roads that we had chip seal on. Once that's complete, Troy will get the center lines painted on those roads. We wanted to wait and make sure that we had as much embedment as we could have on that cover aggregate so that the paint would adhere and that the stones would stay embedded and wouldn't be rolling over, so you'd lose the effectiveness of the paint. Other than that, it's just basic maintenance here for grading roads and replacing pipe. I went to the roadside vegetation management conference last week.
That was very timely, wasn't it?
Yeah, I will be, being some weed commissioner now, I will be looking through some of the literature from the IDOT on setting up a roadside vegetation plan. See what kind of benefits we can get from that. The couple of county engineers I spoke to that were there are very positive about the benefits of the roadside vegetation management, but they also have a committed roadside vegetation manager on staff.
Jeez.
Well, that's what I told them. They said, well, do you guys have one of those? I said, yeah, he's me. So I'll see what we can work with that.
I know Pathfinders either has some grants, and I don't know when the programs are starting, but you might want to touch base with Ashley or Blake and see if there's anything through some of their programs.
One of the main benefits of it is you can get free seed from the tall grass prairie consortium.
At Iowa State?
For actually you and I.
Really?
Yeah. The downside of native plantings is that they don't come up quickly. So from what I've learned just last week on the presentations, the seed you get from the tall grass prairie consortium is all pretty much native grasses. So you have to add a cover crop to it. So you're, even though that seed is free, you're still going to have to purchase oats or annual rye and blend in with it so that you get erosion control benefit that first season.
Nice.
And that's, I think Scott tried that earlier and they didn't continue with it because of the slow germination time.
Right, and I think sometimes it takes it a few years, you know, the first year it might not look very good,
Yeah.
but give it 3 years.
But the engineers that do have it have said that it really cuts down on the need for roadside spraying and roadside mowing.
Good,
So
that's worth something.
we'll experiment, I think. We'll see what's involved and what we can do. But I don't want to jump full 2 boots into something and find out I'm up to my hips in a mud pie. Other than that, I've got a couple other items on the agenda for you folks.
Sure.
Our dump truck is in. It's heading up to Henderson, so let's see, we paid for, I think you guys signed off on the payment for that last week, which is the truck and chassis itself, and then the box and the rest of that stuff will probably take 4 to 6 weeks to get completed. So we hopefully will have it in time for the winter season.
I hope so.
So Abby, do you know, do we need to do anything or as far as moving? You know, we set aside 3,000 in the budget for this fiscal year for weeds. Does he just submit claims to code it with that number, or do we move that money?
That seems to make sense just to keep those two
Separate.
separate.
Okay.
Yeah. Well, we would take that from public or from the Board of Health's budget. And
No,
transfer
the
it.
weed commit, weeds in ours.
Oh, you're right. You're absolutely right.
Yeah.
I just want to make sure it's done properly.
Right, but what I hear you saying is he can just submit claims
Under that we-
and just code it for.
Because we'll have to approve it anyway.
Discuss and consider hiring Alan Melcher for a seasonal position with the secondary roads department.
Alan, when he retired, had indicated that if we needed a hand, he'd be more than happy to come back and help out. And actually, he said he wouldn't even want paid if he'd just do it for free because he really enjoys working with the guys. But in my opinion, if he's going to be helping out, he needs to be getting a paycheck. But he's effectively my age or a year older, and he's in good physical condition and enjoys doing the work and enjoys working with the people.
How much money do you think this project? Because you're painting yellow lines.
Yeah, he's going to help we anticipate him helping Troy out with lines and signs. So it might be 2 partial weeks. You know, and then if it's something that I would like to have it set up that if we are shorthanded sometime in a pinch, if he's available, we could use him. You know, we've dropped one employee and not replaced him when he left. And
You know, I would say that on the way into town today, it was dark. We do need to paint those yellow lines.
so
So right now, it's just a temporary need, but you want it, the ability that at some point, like a PRN position.
I would like the ability to, if we are in a pinch, that we could call him up to work a half a day or 2 days or,
And he could also help out in snow.
without having to go before the board.
Right.
And
Just to kind of have him
Like
as a,
like
Can
when
you
somebody's
just-
sick, he would fill in for them.
can you just do us a favor and when he works, just let us know, just so we hear it from you and not somebody else.
Sure.
Okay, I'll make a motion to approve this. I guess the resolution, seasonal employee shown below effective October 9th. For Alan Melcher.
I'll second that motion. All those in favor?
Aye.
Aye.
Aye. Motion passed. Thank you.
Yeah, it's been retired more than 4 months.
Yeah, almost a year, I think, if not over a year.
Yeah, it's been a while.
It's an IFRS policy.
Yeah, so that was, I think, speaking, Melissa kind of handled that, but if he's seasonal, then he doesn't qualify for IFRS, it doesn't mess up any of his.
So it wouldn't be considered IFRS employment.
Correct.
No,
That is my understanding of it, but I am not.
He's not gonna work enough.
either way, he would not draw because, yeah. Discuss and approve revision of Jefferson County Secondary Roads 5-year program.
When we rejected the bids for the patch and overlay project, I approached the DOT, asked them if we could reallocate those funds and pretty much just set up a more broad scale pavement repair program. But we had already had the five-year plan approved, so this is just an amendment or a revision of the plan, adding the patch project. And then what I found out Friday is that because we revised it from a patch and overlay to a patch, that it needs a new project number. So the next item asking for approval of final plans, we don't need to do because I had to drop back to the check plans on that as it's a.
Do we
More
have
of a
anything
revision.
on this in here? In our packet? I don't think we do.
No. Not. And the only signature we need is Susie's on that. Because it's not a full amendment, it's just a revision. And that's all farm to market funds, so there's nothing that comes out of the road department budget on that other than our time to manage it and design it. But that will be on Salina Road, Glasgow Road, Dowds Road, and Old 34. It's not everything that needs patched on those roads, but it's trying to identify and take care of the worst sections of pavement.
Okay, I'll make a motion to approve it.
So what do we approve, just so I'm clear here?
The revision.
Revision to the 5-year plan so that we can.
So we're skipping the,
It's a motion for the revision of a 5-year plan.
I have a motion and a second. All those in favor? Aye.
Aye.
That motion passed. Just Bart, you're up.
we have one more thing on the agenda.
Tab subdivision.
We had some miscommunication with the DOT. When I put the check plans through, they passed on them. When I submitted the final plans, they said I needed to go back and redesign the project as a patch instead of a patch and overlay. So I was trying to cut one step out. They slapped me on the wrist and told me I couldn't cut corners.
Good. At any rate, there is a discuss and consider tab subdivision, but I have nothing in my packet that indicates that.
Don't want to think about it.
So we're gonna pass on that. We're gonna table that.
Is that Tab and Heisel?
Yeah.
Amy Heisel?
Yeah, and Hazel two tab.
Good
and
gosh.
now
And
it's
they-
tab and-
Again, we have no paperwork.
Yeah. Oh,
No, so put that, we do that for next week. Okay.
I think they probably put it on the agenda.
Discuss and consider,
Nobody's here from them.
discuss and consider a resolution in the Jefferson County Sheriff's Office hiring Garrett Hewmaster as the correctional officer. You're hiring a lot of those lately.
Well, one of our last two hires backed out because of, they started without vacation or sick time, and he was gonna foresee some time he needed off, so he stayed with his old job. So we hired Garrett instead. So it takes him a year to get any vacation.
Yeah, yeah.
So, and again, he starts at a reduced wage for a full year.
Yeah.
Full, full year of probation, so. So we got him started, I think, October 3rd.
Garrett.
Garrett,
Okay.
Garrett. Good kid, so.
Is
Seems
he,
to be a
is he
good
local kid or is he transferred?
I don't have a lot of information on him. I didn't prepare for this. So no, I don't know any information. He lives here locally anyway. I don't know if he grew up
But
here.
he's shown up for work.
He's shown up for
Well,
work,
that's
That's
good.
good stuff.
and we've already put him through quite a bit, so he keeps coming back.
All right, I'll make a motion to approve
Second.
Garrett.
Howmaster. Hewmaster?
Howmaster,
I pronounce it Hewmaster.
Okay, Hewmaster.
Hewmaster,
As long as we're consistent. that's what
correctional
we say.
officer.
Do I have a second? Okay, motion and a second. All those in favor?
Aye.
Aye. Tell him congratulations.
Okay, I will. So,
Thank you very
you.
much. Discuss and consider potential tax abatement for Jackson Point.
Do you know if you've heard anything from,
No, I mean, this
Okay.
is just nothing more than what was discussed last week, and just that the idea, of course, is that it's going to kind of help incentivize continued running of Jackson Point.
yeah, I just didn't know whether Jesse Burns had gotten back to him or not.
I think he's in the building, but I can also text and see if he has additional.
Well, see, he's not like Elvis, because Elvis left the building.
I think it's Ellis Costello and Lee. And Lee.
Yeah. I always remember those concerts. Elvis has left the building.
Are you texting him? Yes.
That's me.
I do know while we're waiting, I got from Iowa Finance Authority, they did inspections in March and April. And their findings and the response from Keyway Management, so all of the problems that they found that corrected. Or
Okay.
there was quite a few, actually.
Really?
Yeah. I'll forward that to you so you guys can look at it.
Sure.
I sent it to Chauncey and to Sean and Becky,
Good,
Gina.
Mhm.
thank you.
So I would imagine we can just proceed onward and find out.
Okay.
The next item on the agenda is discuss and consider selling the 2014 Chevy Equinox. Any comments on that? I guess I have a comment. We're furnishing a vehicle. That person, whoever drives that vehicle, could just as well get the mileage rate from their institution, I guess I want to say. But I don't feel we can keep doing this, because what do we do when it runs its life out, the usage of that vehicle? Do we buy another car? I just think it's time that we end this.
Well, I certainly am not, would not advocate buying another car as far as that part of it goes. And we talked very early on um, about moving forward beyond that. I still have, I don't know unless one of you two received any further communication from Joe Benz.
That I heard.
There was nothing that he indicated in the conversation that we had with him that our insurance would cover that.
To me, Lee, I don't even think it's the cost of the insurance or will it cover it or not. We just, there's some point we've got to cut the strings. And that car is of value to us now. Do we just wait till it's of no value? You know, or very little value?
Well, I guess my question would be, I don't know what value we would, I don't know what value it has in terms of selling value as opposed to moving it to, and I don't know where you'd move to actually, but
Yeah, when we initially talked about this, and this has been several months ago before your time. but,
Right.
We didn't know if like environmental health would need a vehicle, because we knew Dan had a little pickup.
right.
Um,
Yeah, I mean, I know at one point, and Joe brought it to the board, we talked about whatever you want to call it, deeding it over, whatever, to public health instead of buying the one that they
Yeah,
purchased.
and they wanted a four-wheel drive.
So
Does
I don't have any
ambulance-
problem at all disposing of the vehicle. I guess the question is, do we have to, and maybe this is a question for Elizabeth, do we have to auction it or do we just list it for sale and, or does it go to the highest bidder?
Do
Or
we know what it's valued?
No,
No, I tried to look on Blue Book and all I got was.
I would say a bid
advertisements.
process, similar to what Sean sold the little truck for, not that long ago.
Do you remember, I was thinking it was bought with Fund 10 funds, was it?
I would have to look, I don't remember.
Part of me-
I would guess that you are exactly right.
And so
because-
it's really their vehicle then anyway, if it was mental health funds, isn't it?
Well, according to Ryan Wood,
I know they don't want
well, no,
assets.
but according to Ryan, we had a conversation here years ago over a building that was in Des Moines County, if you remember. And they said because it was purchased with Fund $10 that they owned it. And that's when I said, fine, then we'll transfer the title to you. You buy the insurance and pay the fuel. And then they put their hands up and said, no, you know,
We
we
don't
don't
want
want, you
assets.
can't have it both ways.
Well, and I remember Ryan and Sandy came, and again, this was when you were on your hiatus.
Right.
And we had this conversation. And again, it was probably before your time too, Elizabeth. Because we talked about liability and that, and they said, oh yeah, they'd cover it. But you know, it was all conversation. It was nothing in writing, and it was all very up in the air, basically,
About whether or not we can sell it or whether or not it's covered, sorry.
whether it's covered.
Whether it's
We
covered.
didn't talk at that time about selling it. We were just trying to figure out logistically with all the changes. It would have been when the state took
Well,
over.
and I think Susie's right in the context, and you just mentioned it, with the little conversation we just had. There's so many gray areas here as to who is what.
Hmm.
Okay, I understand that on one level, you can say they're an employee. On the other level, we have no jurisdiction. We can't terminate. We can't, I mean, so all of these things, and I just think this is, personally, I think that this is one area that we can control. Ryan has said, because I talked to her very early on about this, that if we were to sell the vehicle, because it is indeed our vehicle, that they would pay them 65.5 cents a mile to use their own vehicle.
And
I
that's
think it's a
true.
no-brainer.
Yeah.
It's fine. I'm neutral. I don't have a
Yeah, no, I get
strong
it.
feeling either way.
Now, if they want to buy the vehicle, I'd be
Now,
perfectly fine with it.
I'll see him Wednesday. We have a board meeting.
I don't have any problem in that regard. I just think
Yeah.
that
Maybe another county would want to buy it for them.
Well, I just think that what you're saying, Susie, makes sense, that, we've got to cut the umbilical cord here at some point.
At some point, we can't wait till the child is retirement age.
And the fact is that
Get them out of the basement.
Yeah.
we are really, by law, Elizabeth, all we are is a fiscal agent, nothing more.
Yeah.
And I'll give you a perfect example. Regional Utility Service Systems operates under Lee County because Lee County is their fiscal agent, so they follow their handbook, but they are not employees of Lee County.
Right.
Lee County cuts their checks, the whole 9 yards, but anyway.
Lee, I just feel that we aren't doing the citizens of this county any justice by just letting another agency use this vehicle, and then sell it when it's run out of the, I think there's a time to cut the purse strings.
So I'm going to ask Elizabeth another question. If we make a motion to sell the Equinox, can we give in that motion first opportunity to regional or to, it's not seal anything.
Mental Health Agency of Southeast Iowa.
Yeah,
You have to go through this bid process.
okay,
They're not gonna buy it, Lee, because they don't own any assets.
okay.
So would you repeat what you said?
You have to go through the bidding process.
Yeah, I agree with
Okay.
that. I have to. Sir, do you want to buy it?
Usually, no, but usually if we have something of marginal value, we take it over to the auction house. I believe.
Steffes.
Yeah, Steffes.
So do we need to value it first then? I don't know if it would be considered marginal value or not.
It's gonna be less than $10,000, I would think.
I don't even know what year it will be.
2014.
The paper says.
Well, knowing the value might be helpful then.
And I don't know the
Determining
model.
whether, like, how you can dispose of it, certainly.
Then we're gonna have to figure out where the money goes.
But you can't give priority to,
Right, okay.
Right.
one entity.
I don't think they're gonna want it, obviously, but
But we still have to go through the process. So should we table this one more week while you have your meeting and report back to us? Or what do we do?
So do we want to, again, Elizabeth, I apologize for keep asking these questions, but if we listed in the paper, posted on the board, bids for such and such a date, say 4 o'clock on whatever.
Yeah.
And it goes to the highest bidder, okay? Rather than pay somebody a fee or a percentage to do that way?
Yes.
Okay,
I mean, you'd have to give public notice and
Right.
then, proceed. I think that we've disposed of other property that way.
because I suppose by the same token, when you start doing all the public notices, probably not much more than what the fee would be. But the fee would be
True.
much more.
by the time you publish it and you buy it.
But at the other hand, you've given all the citizens an opportunity to bid on that.
Okay.
What do you want to do?
Well, I think we just get I don't know whether you use Kelly Blue Book or what you use, but just get a value of the vehicle and I don't know, if you're gonna take it to the highest bidder, are you gonna put a reserve on it or are you gonna sell it to whatever the highest bidder is? See, if you send
Well,
it
you
to an
can't put a
auction.
reserve on it if you take it to auction, can
Yes, you
you?
can, yeah. If you take it to auction, you can put a reserve on it and say, okay, I say it's worth $10,000, so I'm not gonna take less than that. And if the bid comes in at 9,000, you have the option of taking the reserve off. But, so somebody won't come in and give you 1,000, is what I'm saying.
Do you guys remember how Sean did it? With a
I
little
do
red truck?
not, I can find
That's
out.
exactly how we should do it because.
I just know it was parked out on Liberty,
Yeah,
Liberty Drive.
it would give us the opportunity to be very consistent. Dee, do you want to call him and find out how he handled the sale of the truck?
Yeah, sure.
Do we need to take a couple minute break?
I wouldn't be opposed to it.
Okay, let's take a little break. while she's doing that. Okay.
I heard back from Chauncey, sorry, just that he hasn't spoken with Jesse yet. He says it doesn't really need to be on the agenda until we're actually going to be abating it.
Perfect, thank you.
Mhm.
Thank you. Mhm.
Hey, Sean, it's Dee. Can I put you on speaker? We have a question for you. Hi, we are thinking about selling a vehicle. It's a 2014 Chevy Equinox. And we just wondered what process and procedure you used when you sold your pickup.
We've done this a couple times. We just, I don't know that we don't have like a written policy, but just kind of out of fairness, we usually publicize it as a sealed bid. And then, put down at the bottom, like, we reserve the right to reject all, if you get some low ball thing, depending on how low you're willing to go, but we've had good response. And then set it somewhere where people could see it, obviously, but that's all we do is, give them 2-3 weeks and put it on. I don't know if putting it in the paper works. I think
Did you
we
put
did
it in?
well the last time because it was setting up on Key Boulevard where they have that road closed. Just had a lot of traffic by it.
Right.
The process by which you're gonna
Okay.
have a bit on it.
That
And
answers-
then go through them and usually just pick the high bidder. It's not super complicated, but I think that's a reasonably fair way to do it.
Okay,
Elizabeth had a.
do you have a question?
Yeah, well, no, I don't have a question. I just think maybe you could express your intent to sell it. You set it for a public hearing and then, that you're gonna be selling the property and then you can outline the procedure by which you're going to accept bids.
So we can put that on the agenda for next time.
Okay, thanks, Sean. We're done with Sean,
Yes,
right?
Sean, thank you very much.
Yep. You're
What?
welcome.
Thank you.
Yeah, that's what I would recommend.
Let's wait till he comes back.
But you don't have to accept, the
Yeah,
highest
that would
bid,
be-
even though if it's like well below the value. That's why I think having the value would be really
Yeah.
beneficial too.
This will give us time.
Well, that'll give me a chance to talk to Seal.
Is it high mileage?
I have
We
no
don't
idea.
know.
We need to go look at it and find out what it is.
Be helpful.
Because what model it is, because when I tried to search, of course, when I know the model, I just put the midline one because I figured it wouldn't be.
Equinox. Oh, yeah, but there would be other.
It would be different models.
Do you drive an Equinox? What year is yours? Can I ask? What would be a low model? Of course, we'll check with Festlers or something.
I just ran 175,000 miles on it, and the lowest, just the LS option, and it's 4250 to 6200.
Yeah, it's not good to know. I doubt this one has that many miles though.
She's had it for a while.
I think you'd be surprised because we don't track how many miles.
Instead of going to Kelly Blue Book, try Auto Trader.
Okay.
Yeah.
That's what they use out here, Festlers. It's
I know
Auto
we're still
Trader now.
on Zoom here. So.
Mm,
Look at it, every point's.
I'm sorry.
No,
Well, we're
no,
taking a break.
it's fine, we can break.
Search it. 90,000.
Yeah. Well, especially now, these vehicles are worth a lot more. The thing is, where would they put them? I just think in a general. Would you check the price of a shock collar out for me?
Equinox.
I'm sensitive. I know that. As a public hearing,
Hey, Elizabeth, do we have to have a public hearing or do we just need to like advertise it?
a public hearing would show our intent to anybody listening, the 3 people. Maybe 4.
My understanding is that public hearings
I know.
required, but let me double check.
Well, and I'm fine with public hearing it, just, with publishing it costs too.
Yeah.
And actually, nobody reads that anymore.
Course, information is in Mount Pleasant.
I don't remember off the top of my head.
There are auto companies that
There's all kinds
will
of
buy.
information.
Lima, I hope
We
he's
just,
not
we always
talking.
feel that we get more exposure going through them than if we just advertise it locally. Because they're more of a, have more of a regional footprint
Where's that?
going south.
Yeah.
And then if it's, if it's a piece of heavy equipment, we'll
Where's
sort of purple wave.
We're at 7 minutes. Make sure he's not talking anywhere.
Maybe a paperwork issue.
I'm not coming up with anything. But
Anywhere you need to go.
no, it's just new. If they get lost.
I sent Brian to find him.
Christmas is still on.
They sent out the rescue squad, right?
Search party.
We know you, Lee.
Lee, thanks for finishing up with your other meeting so quickly.
I was. We were discussing with a constituent how great the bridge project was going.
Basically, we called Sean and he said that he does, try to publish it and then let it sit out somewhere 2 to 3 weeks. And he does a bid with the reserves the right to reject the bid. Sealed bid.
So do you have a motion? Do you have a motion? A motion to proceed with selling the Equinox
I'll make that motion.
through sealed bid process. Right. I second that motion. All those in favor?
Aye.
Aye. Thank you. Next is discussing considered county building keys. Brian,
Yes.
we want to make absolutely sure you and your employees have returned all the keys to this building.
Yes.
Yes.
Okay,
Yes. All
Okay.
keys have been turned in.
okay. That was,
They were turned into the auditor's office.
okay. Discuss opioid funding.
All right, I've been getting some questions on that. Nothing's really changed. I'm gonna talk to ACT because again, that's a group that kind of is on the front lines and it's been going long enough. They have some really good input. I've talked to them a couple times, probably last winter. Everybody is pretty quiet and I guess there's been some questions. We still have in round figures, it's 112,000. It's a little bit over that. Nothing's been spent from it. We don't know when we get the money or how much we get. One fund is like 16,000 a year. So all the research, I went to that meeting in Des Moines in May, which was put on by the SAMHSA government people on ways to use it. Made some good contacts. I met with Chris Rankin, who I met up there. She's in Van Buren County. And she is funded, and I think we should look into getting this. I've already,
Get my email?
yeah, I did. So you don't think we could apply for it?
No, a
'Cause-
government entity can't be a
Well, tell me this, because I asked Chris, who actually employed her, and she said it was through the school district down in Van Buren County.
Okay.
So I don't know how that works. So maybe, I don't know. And I talked to Ashley at Pathfinders because she writes a lot of grants, but I said, don't spend a lot of time on it yet till we see if we're interested. So let me tell you what there are. There's 2 grants. One's a strategic prevention framework partnership for success for communities, local governments, universities, colleges, blah, blah, blah. It's 300,000 a year with no match. Of course, it has fine print, and I think the cycle's already up for this year. I think it's next March. Yeah, it'd be June 5th of 24 when the next application would be. And then there's another grant. It is less than that and has in-kind. I lost page 1 to it. So it was for 125,000. It's a DFC. And you'd have to do 125,000 in kind. So what she does is she goes around to various community organizations, works with them on not just opioids, but substance abuse in general. Like she goes to DCAT. You probably met her up there. And she had some good ideas and things that we had learned that reinforced, because I was able to ask her more in-depth questions from the training in Des Moines. So I just have a laundry list because I've talked to anybody in the community that is interested or has a clue or an opinion. And here's a laundry list of things. And I think this one came from Elizabeth, fentanyl test strips, to buy those. And that would be for law enforcement.
I was thinking for community members.
Community members, and
Yes.
we can also do naloxone for anybody.
Yeah.
And supposedly it's free through CETA anyway now, but see, people don't know that, so we could potentially do some kind of a media campaign. And I'll go through the stuff today in ACT. Somebody put it on the, I was gonna say the menu, the agenda. So reporting on it. Some counties are combining it with other counties because I had heard where some of the mental health regions are getting involved in it. And so I asked somebody how that happens, and that's if the counties had given any of their opioid money to those groups. It can be used for substance abuse treatment. I ran into Curtis from a hospital last week, and I asked him a few questions about that. And so he's gonna get back to me, but there is a expert screening tool that can be used in doctor's offices. So I asked him about that, if they might be interested. And it's screening, brief intervention, and referral tool, whereas when you go to the doctor, they ask certain questions. So that's one of the, again, it has to be evidence-based treatments. A lot of people say we'll do a program, which is great. If we do some kind of a program in the schools and for the community, then we need to have a plan for some follow-up. So it's not just a one-time deal. Ambulance-wise, any input on how prevalent, anything you've seen with opioids or overdoses or anything?
Nothing.
Not yet.
Nothing
If
yet.
you do, just, I don't need to know who, I just want to know
Right.
numbers. And in one meeting I was at, it was the Medical Assistance Advisory Council. They said there was a new dashboard coming to the public health website, and I haven't been able to get on there and find the detail, but supposedly you can go in and find data for your own county on it, at least like ER visits and things like that. There is a school curriculum, then life skills, which deals with substances, anxiety, and bullying. So that might be something if we could get that into the schools, and we will ask ACT about that group, because that'd be the group to recommend whether that would be a good idea. I know schools are so busy with what they teach anyway. One suggestion was put up resources into a booklet, and then all the community partners have that. One of the speakers that was mentioned can do middle, high school, and she had a son that when he was 13 or 14 smoked some of today's marijuana, which apparently is very addictive immediately and can rewire the brain. It caused psychosis for this child, and by age 20, he died from suicide. Do one thing and do it well, or else find gaps in the system in your community. And I think that's definitely one question for ACT, where are the gaps? Because, so that's kind of
Yeah,
a very overall,
yeah. I have a question.
yeah,
It's about the money as usual. Who decides? Who is the main decider?
Board of
Okay.
Supervisors, it came to the counties.
Okay, that's what I thought.
So,
So I think we should all be included in that, what we do with the money.
yeah, I think we need to probably get some consensus from community partners,
Yeah,
which the ACT has a very,
yeah, I haven't been to the ACT meeting for years. I used to be in that committee before I had this position. But I personally feel we need to help the youth in this
Mhm.
committee or county first.
and we need to know how to do that.
Yeah, it's too bad we don't have the Mr. Pumpasai from the Fairfield High School come and ask him these questions.
Yeah.
Because he deals with it. I mean, we sit here, he deals with that every day. I know they've had the drug dogs down there many times, but you know, I feel you can, and I'm on my high horse here, but you got to help the kids when they're younger and they'll still listen as opposed to when they're.
You know, at that meeting at Des Moines, they said you need to start educating kids on drugs at age 9. Because that's when a lot of their mental health issues will start, and they'll try to self-medicate.
Yeah, and I think even before that.
And then when this was early on, I'd asked the sheriff's office for input, training and education for staff. Equipment purchases pertaining to drug and alcohol testing. Possibly alternative housing fund. SRT tactical equipment. Munitions and ammunition purchases. I'm not sure if those would qualify. So maybe some forensic software purchases. We need to flesh that out a little more. Anyway, that's kind of an overview, and we'll probably have more input after ACT, but that's kind of where it is. Any
committee reports from you?
Well, I was at the special public health meeting on Monday, a week ago, 6 p.m., and they discussed moving forward and with the retirement of Dan Miller from environmental health. And they're in, I guess what I'd say, contract negotiations.
I think it's a done deal.
Okay. So they, Joe's a member of the Board of Health, but they, at least while I was there, tentatively wanted to look at a contractual agreement with Russ. And Bruce indicated that they would move the current environmental specialist that's in Mount Pleasant, or actually in the county, would move that individual over here if that's what the Board of Health wanted to do because of the experience. He didn't want to start a new program with an inexperienced individual. So they provide the vehicle, they provide the fuel, they provide everything under the agreement. Any monies that are received goes to the Board of Health, does not go to us. They don't do counter transfer inspections. They see it as a conflict. There'll be you'll want to go through all the files that currently exist and see what's out there to be done. What's kind of set there and languished in any, in other words, you know, so we'll be full-time. And by that, I mean that they will have somebody here Monday through Friday. And like I said, that all the fuel, all the costs, the new vehicle, everything will be borne by regional utility service systems, and maintenance, upkeep, everything. And so they talked about grants to counties, which I'm not 100% sure what all that is, but that's always been figured into Dan's budget. Those grants to counties, they'll still apply for them or submit to them or whatever it is. But Bruce explained it a little bit. So you do all of these things that qualify and then you submit them and then they reimburse, but that reimbursement will go to the Board of Health. So the finer details of the contract, I don't know what they are. As far as that part of it is concerned, I know the board gave authorization to Christie and Melissa, I think, Christie anyway.
Lee, hey,
Uh,
it's Chris, Lee.
Oh, okay.
Hey, it's Chris. Hey, I just wanted to tell you that I got a copy of the contract. It's been signed by the chair and the vice chair of the Board of Health. It's going to the Rust meeting for consideration on Wednesday, the 11th. And that was done with Chauncey's revision for the directive of the board meeting last week.
So, yeah, so it's, go ahead, Chris, sorry.
No, I just want to give you an update on where that was at.
So we will be, oh, I thought you,
Stretching.
we will, the board, Regional Utility Service Systems regular board meeting is Wednesday. So it will be determined by the Rust board as to whether or not we accept the terms of the agreement or whatever. And at that point, then the powers to be will notify each other and everything.
Can I ask another box question? Would there be any reason to consider combining that with nuisance? Because nuisance is pretty minor right now.
Yeah, and Bruce, that question was asked at the Board of Health and he will not do that.
Okay,
That they are, the tween doesn't meet.
Yeah.
For one
different skill
thing,
sets.
he will be answerable to the Board of Health
Right,
as opposed to being answerable to the
Right.
Board of Supervisors. So that in and of itself,
right.
in that context, I do know that it came in less than what Dan's budget was. So what the final number is, I'm not sure. I haven't seen it yet as a board member, but we'll see it on Wednesday.
So essentially, they've got the money to do this without any more funds.
At least what I saw.
Okay.
You know, what I saw was what Russ offered to do it for, which was less than what it was currently being done for. So you'll actually, what's we're looking for, when that transition takes place, there isn't any additional funds needed in terms of what the Board of Health has to do.
Yeah.
Can I interject? I understand we have providing with an office. The county's got to provide the Russ with an office,
Yeah, there would have to be a location.
a location. Yes.
Yeah. Currently, Dan is it and has been for years, way back when Tom Goff was still here. It's where environmental health has been stationed or located, was at the county engineers building. So he doesn't have a dog in the hunt, meaning Bruce. It's just that they have to be housed somewhere. Not an inordinate amount of space. But I can tell you that the space where these currently at is, adequate in those terms, doesn't need anything more than that as far as physical size goes. I don't even know what Dan's got there for sure. I know he's got 1 4-drawer cabinet, and he's got a copier and a desk.
Yeah, we'll have to talk to engineering, might have some use for that space.
Well, you're gonna have to make that determination pretty quick. Because the transition takes precedent, and if you're not, I mean, I guess what I'm saying is that, you know, the swap is, I guess, October 31st. It would seem to me that, you know, but
Is that what they're projecting for this to take effect?
yeah, he's leaving. Excuse me, his last day is the 30th.
Okay.
So if there's gonna be movement, physically, I mean, then you have to determine where that movement's going to be so that it can take place before the 31st. Not, well, you get my drift, you understand, I mean,
Sure,
there's
sure.
not gonna be a lot of construction going on in terms of, but they will continue to do tattoos and pools and all that happy stuff. So,
I've got another update.
Sure, just to his point, I think we should have a work session to talk about space.
That's a good
Okay.
idea.
We've been wanting to do that anyway, so.
Can we do that this week?
Reed, do you have any appointments this time?
I have doctor's appointment on Thursday, I take the truck in on Wednesday.
How about Friday?
No, Friday's open.
Is Friday good?
I'm at 12 o'clock, but if we do it earlier than that, it's fine.
7:30? Okay, 8:30?
8:30 Friday.
Abby, I'm sorry, but thank you very much. When we have all the space filled, we can't do this anymore.
Right? Oh,
You
I've got
said
it.
you had something else.
Yeah, so Thursday I went to Des Moines. I'm on a Justice Advisory Board that's a governor's appointed position, Senate approval. And they're doing their 3-year plan for the legislature. And it was really interesting, and I'll send Elizabeth you and Chauncey the draft. But they have to come up with recommendations for the legislature, and the board's responsibilities are a 3-year plan and annual updates, short-term, long-term goals, identification of issues and studies on the effective treatment and supervision of adult and juvenile sex offenders and institutions, community-based programs, and the community analysis of recommendations regarding current criminal code provisions, effectiveness and efficiency of current criminal and juvenile justice policies, practices, and services, and collection of data related to those. Now, it was interesting, it's a different group of people than we typically used to working with, but what was interesting is in this group of folks who work a lot in this world, I kept bringing up the real world examples of what does this mean for rural Iowa, and they kind of looked at me. And one other person in the room of like 20 people shook their head, but everybody else is like from Des Moines or, you know.
Yeah.
And the other
Yeah.
one was, who's gonna pay for it? Please don't recommend anything if you don't get funding. And then going ahead to list some examples of how counties are paying for, you know, the juvenile lodging, basically, the people sitting in jails way too long that are state. So it was helpful that group heard that voice. And I think it opened their eyes a little bit. So they'll be coming out with a revised draft, and it was an interesting group, and I got involved in that while I was asked to, and then because I'm on those boards right now, it was just interesting.
What the board name is.
Justice Advisory Board. And I believe it is one that probably may not be touched with this new revision, but I guess we'll all wait and see when the report comes out, how the boards are gonna change. Okay, claims.
So, Abby, help me out here.
Okay.
There was a safety committee meeting on Wednesday, and I was on the phone listening to it. And they were speaking about a lot of the stuff that we talked about at the department head meeting. But the biggest thing that hopped out at me was when Stacy from IMWCA asked me what the annual salary, what the salary rate top was, or we expected to pay for the ambulance people. Of course, I just threw out a 1.4 million. She told us, and later she came over and talked to Abby and Darcy and I. At 1.4 million, we will be paying $4.28 per 100 of wages. Which, what did we figure that came up
That's
to?
roughly 65,000.
All right, I'm totally confused here. Were we?
We're working.
It was for the workman's comp.
Okay,
And so that's what we're paying to have that.
It's gonna go from 144,000 per year to over 200,000 per year.
Just based on that. We did ask her currently without the ambulance. She said that the sheriff's department and the roads department were the biggest users of that service.
well, my question though is, okay, so we threw out an abstract number. Why did we do that?
Just to hear what she had to say. What do we know what it's gonna be?
Well, it.
We don't have it in
half
the
that,
budget.
be half that. At most, it'd be half that. That's why I asked the question.
For really, at most wages would be half that,
Yes,
because we've already had a lot of overtime.
well, yeah, but that's all been figured into for the fiscal year.
Anyway,
And those numbers, they're all just
it's just to
a
use an,
rough estimate.
No, I get that, but
And
let's understand that when we throw those numbers out and then workman's comp, which jacks us up anyway.
Lee, it was just a number. We're gonna have her come and talk to the board.
I mean,
While budgets are happening.
Yeah.
We
No.
will work with them directly to get all of those numbers
Yeah.
out there.
And we finish here. We need to look elsewhere.
For what?
1015 Transit did it. They said, the hell with this noise.
Lee, I was just reporting what was
No,
said.
what I'm saying is that we don't mix, what I'm trying to say is that I agree with the notion that, but workman's comp, I've felt this way for years. They feel like we're a captive audience, and I think we need to look elsewhere.
And that's a conversation for another time. I was
Right.
just
Right.
threw out a figure so we could see what her answers were. Because I think we all have to be very cognizant of wherever we get the insurance from, what it's gonna cost.
Right.
Yeah, and you
Which
know
is
that.
exactly my point. I think you can do better. Everybody uses what you call it, IWMCA,
I am
FTY.
WCA, I am
And then
WCA.
after that,
Yeah. And it just, you think, well, you don't have any choice.
it's always good to get a comparison. Yeah.
And like I
Maybe
said,
you could, when it comes closer, we.
yeah,
you
I'll
look at
talk
that.
to Jim, because we did, we said,
Find out who they went
we're
with.
not doing this.
Then,
Yeah.
when you get that information, we'll have a work session about that and we can have Stacy
And if we
come as
do,
well. So
when we
we,
do that, we need to have like specific numbers
yeah.
Sure.
on,
Well, there was even a point at one time, which part of the catalyst for looking in a different direction was because, and we had not had claims.
Mhm.
There had been, I think it was precipitated by an accident that had happened. But IWMCA.
I am
whatever it is.
WCA.
when I first started it, or whatever they call it, was high and then it got lower because they had had like a couple things happen
Yeah.
back in the
So
mid.
they told 1015.
10 years ago.
We are gonna cover you.
Yeah, I lived through that process. with
Okay, so
1015.
you reference what, yeah, and then of course, then they said, well, if we do this, they said, we're not doing that.
It's a starting point. Like I said, it was I'm just repeating what,
Mhm.
and then later she came and talked to us over here and it was pretty informative.
Thanks for the update.
She's got a lot of things about our county that are very interesting, At any rate, I digress.
Do you?
I do, Lee. Allow claims and approve reports.
Motion to approve $149,945.88.
A question on the 88 cents.
I bet you do. Motion to approve?
Second.
All those in favor?
Aye.
Motion passed. Thank you very much. Meet with ambulance director. You've been very patient. Thank you. So I've got a couple things I want to talk to you about before we start.
Sure.
We would like you to, upon advice of council, we would like you to sign Cassie's timesheets.
Okay, gotcha.
Do you understand? Yeah, okay. Judy, it just makes it safer for everybody. The other thing is, I personally would rather your employees not come in on to this meeting. Of course, they all can come, it's a public meeting.
Right.
But if they're on, if it kicks them into time and a half, I don't like that. Okay. Just because I'm a jerk with the money. That being said, what do you want to tell us? You got new shirts.
Yes, thank you. Really nice.
They are.
To date, we've run 32 calls, 5 transfers from the hospital. We're still working on our hospital agreement, waiting for Vanessa to sign that.
Yeah.
So they're gonna predate it back to October 1st. Tomorrow I go to Illinois. I'm going to Lifeline, pick up that refrigerator for 52.
Where's it at in Illinois?
Sterling.
Oh, that's
Oh,
only
it's right-
60 minutes.
It's right across from the Quad Cities.
Yeah, it's 2 hours and 45 minutes.
Well, you're a boy from Texas. Somebody else could do it probably a little quicker.
Yeah.
It's not far. As far as Illinois goes.
told you it was a short.
It really isn't that far, but you'll have a nice drive.
Let's see, working with Image Trend, I give them a call today. The billing company is doing our platform for us, they're starting to bill for calls.
Oh,
Yes,
cha-ching.
Chi-Chi, right? I set them up. Talked with Dr. Marino last night, got her access to Image Trend, so she can start doing some CQI. Finished all the CQI last night. See, we got a meeting with Pekin School on Friday the 13th.
Oh, Friday 13th.
Yes,
Okay.
at 08 for their disaster response. Friday night, we have the football game standby.
Here or Pekin or where?
Pekin.
Oh,
Here and Pekin, is
Yeah.
it, don't we have Friday, but yeah, we have one for both here. and
Okay.
Pekin.
I stand correct. Tomorrow, the radio guy is coming out, Dane's coming out, as we discussed at 10 o'clock to get a temporary base radio. Bart's been working with us, and so they'll be out to help us get our comms up and going better than what they are now. Other than that, that's about it so far.
so, every morning when I go by at 7, I know you have the changing of the guard.
Yes,
You have a lot of cars there.
yes. Yeah, they do handovers and make sure everything's, the
Sure.
trucks are checked out
Sure.
and things like that.
Sure. I understand that you might have remodeled your countertop, amended how you want the countertop to be.
Yes,
Okay.
yes, and it's actually a little bit easier. It works out better to cut it so we can put our copy machine there and our shredder
Yeah.
that people use daily.
Yeah, I imagine stuff like that is, you never really know till you get there how you want it to be.
Exactly.
So, yeah. And you got your blinds in. I saw that.
Yes, curtains.
Oh, yeah.
We don't want
Curtains.
you looking at some of the other.
So,
individuals.
yeah. Where'd you guys get those?
Walmart.
Thanks for buying local.
Yes, absolutely. It gotta contribute to the economy.
Good for you.
Yeah.
I heard a lot of comments about they're seeing ambulances everywhere now.
We are everywhere.
Yeah.
Last week, we had 691 calls in 15 minutes.
Span of 15.
How many?
Seriously?
Yes, and we answered them all.
It wasn't me, I wasn't calling.
We answered them all within 25 minutes. They were all answered. Yeah.
What'd you say, Judy?
I said, we actually drove me to one. He's kind of scary to ride with, just so you know.
What now?
He actually drove me to one of the 911 calls because we had 3 of them drop simultaneously. So I grabbed a monitor and a bag.
You
And
need to be careful who you ride with.
I stuck my head out the window and went,
no, he did not. No, he did not. But the people were very
Why do I think
happy
of
to
the
see us
road
respond
runner?
quickly to them, so. And then when my crews got done, they brought the units over and
Mhm.
Would there be any reason that you all would need a 2014 Equinox?
Yeah,
No,
Okay, just asking.
no.
it would be nice if they had a.
It was nice. It was nice having Libertyville response vehicles that's
Speaking-
helped us.
I
out.
saw that when I
Yes.
pulled in to talk to you the other day. That's a nice looking vehicle.
Yeah.
Speaking
Yes,
of which, we should put that back on the agenda to see about that sign.
Okay.
Would you put that on?
Discuss and consider sign at 1900
Right.
West Boylston.
I think we'd be remiss too in that when those 6 calls come in. Kudos to Fairfield Fire and Rescue.
Yeah, they went out on every call with us.
You know, everybody's doing their job and working well together, is what I would
Yes.
say.
That's good.
Very good.
Yes, absolutely. So, and the hospital's happy with us doing the transfers. Our response times are fantastic. And they're within 10 minutes. So,
If you guys, how do you handle that runaround? I mean, roundabout, I call it the runaround.
The roundabout.
What do you mean, how do we handle it?
Well, it's kind of confusing down there. Isn't? You guys are good?
I just wish they'd hurry up and get this construction done because going from campus clear
yes.
across town, it adds at least 5 to 7 minutes.
Yeah.
To go clear down through town, you know,
Mhm.
Libertyville Road and now. You know,
Can I drive one of your vehicle, that vehicle if you need to go somewhere instead of leave? I just want you to know I'm available.
sure.
Well, lucky for us, Lee's reindeer know where to go all the time, so. It's not really driving, it's kind of.
Yeah.
Well, he tried to take my sleigh to go pick up the refrigerator. He said he could get there faster.
Oh dear.
Apparently one of the elves were using it, so. couldn't-
Anything else you want to share with me?
No.
Judy?
Oh, well,
Can I go through them first?
Sure.
Judy, anything else you want to share with us?
I don't think so.
Damien, I can't imagine you're speechless.
I just have one thing.
Okay.
Oh my God.
It's easy. Have you got a hold of Roman?
But I'm trying, that's Pearson and Pearson.
Just through them, because they haven't been.
Yeah, Isaac was out the other day at the farm, and so I said, hey,
They came and put the vents on.
yeah, do you still have that problem with the,
It's still shaking.
oh, we can't have that.
No, because it'll,
Yeah, I would, yeah. Isaac
So,
said he works.
because I know it's under warranty.
Yeah,
so-
oh yeah, let's get it.
And I just don't want it to,
No,
because getting ready to start. heating
and
up.
so you'll do that, you'll contact them?
If you want me to.
Yeah, go ahead and do that, because
Okay.
you can tell them what's going on, you're the guy that was there,
Okay.
okay?
Okay.
And then let us know, let us
Yeah.
all know what you're doing,
Yeah.
okay?
I can do it.
Okay, Lee?
So, what could my dog was nice, but we'll go back to this refrigerator for a minute. And the cost to go up and get the refrigerator and the cost of the refrigerator and the cost to put the refrigerator in, I think should be borne by the ambulance force. As much as that it broke down during their tenure.
So that board is still in existence, so
There's a
tell,
meeting on the 18th, however, my gut tells me they may say, and this is just my perception, we're giving you 2 ambulances.
They're not giving us anything. We paid 1/3 of the cost.
okay,
Well,
Lee
they're
and Dee, you ask. You ask.
No, I'll ask.
And
I'm
let
just
us know.
Because
saying,
I'm- what-
don't be surprised if,
But hang on a second here. If Julie had done her job. No. What I'm saying is that
Don't mention
appointment,
names. Okay.
that appointment was supposed to have been made.
right,
Mhm.
We all thought that appointment had been made, except that Fessler's knew nothing about it. The refrigerator would have been ordered at a higher cost than it's currently going to
Mhm.
be, because it's $9,000 new.
Uh-huh.
And my whole point is that should have been done under their watch.
Will you make sure you ask them that?
can you get me some
And the
solid
meeting's on the
figures
18th?
before then,
For the refrigerator,
for the refrigerator and the truck or whatever,
refrigerator brand new is like.
What?
like an
brand new
invoice?
Refrigerator, yeah, I can get one. I'm getting it half price through Lifeline.
Send it, just email it to me and I can email it to the board.
Well,
Yeah. Thank you for doing that.
no problem.
And then whatever the bill is to install
Well, I don't have that yet.
No, I know.
Fessler, so when I get back, we already made an appointment with Fessler to take out the old one.
Is that this week?
So, no, I think
It's,
they're back there.
it's gonna be because I have 51 going in on the 18th because they're still booked out because they turned over the ambulance 200 miles over service. Just so the board knows. So, that has to get fuel filters done, has to get everything done, because
Mhm.
it was already over, now it's gonna be over by the time it gets in there. So that bill's gonna be pretty, because it's getting air filters, fuel filters, inspection done. everything
Preventive
done.
maintenance.
Right,
Yes.
so,
Yeah.
just so you know, because when I got them, and then I looked over and I seen that, and I'm like, okay.
It's
And-
okay.
Yeah,
It's okay.
and I mean, it is, I mean,
Yeah.
it's.
Brian,
Yes,
you're going tomorrow
yes.
because it's good chance to rain the rest of the week after
Yes.
tomorrow. So I appreciate you going
I'm
tomorrow.
going in the morning. So,
Okay.
There are probably another 2 weeks.
and getting it, that saves us on shipping costs. So,
Absolutely.
it. So you should be back by what, 8 AM?
If I was, playing cue balls,
I know, yeah.
right, and singing "Here Comes Santa Claus," I would be there quickly.
Thanks for going and getting it.
Absolutely.
Appreciate that. And you got a tarp to cover it and all that,
I do.
because it sounds like a pricey deal, even at half price.
Right.
Yeah.
Well, have prices like $350.
Yeah, thanks for going the effort of
Sure.
finding a good deal.
Yes.
Okay. Do you have anything else you want to tell us?
No, I think that's it. We'll see what today brings.
Damien has another thing. We waited too long.
He did, sorry. Who are we using for exterminating?
I'd say get a cat, but what are you talking?
Well, I know, I would love to have a base cat, it'd be
I
fun.
can bring Sophie.
I mean, but I was just wondering who, because we haven't had an exterminator out there. So I didn't know, and I found some spiders that you could put a saddle on and ride, so, I mean, they were huge. So.
I would say step on them.
Well, it was up on the wall, so I really I can't flex it.
I would just,
Just
So-
so like.
we don't have anybody definite. call there.
I know, that's what.
No, probably call them there.
I just.
Okay, one at a time. One at a time. Abby, what do you do with the bats here?
Scream.
Okay.
Call Dave.
Tennis racket.
Bats are fine. There was one cooped up on the outside the door the other one day when we.
You might want to just talk to Dave to see who
Yes.
he,
I was just gonna use the ones down the road
Abby?
but.
that probably makes sense, but
Abby.
Dave might have a good or bad experience with one of them.
Cause that's the one I
That's
always
who I
use.
figured it would be.
That's who used to be the courthouse, I don't know if they still do. I haven't
Who's
seen
that?
them.
Who's that?
All American Pest Control.
Oh, yeah,
That's who I
that's
was
who we're
gonna-
thinking about.
that's what I was
Aren't they like the only game in town?
Yeah,
Yeah.
and that's who I've always used.
Not a lot of options.
Every single. base.
Second choice, we can send Dave over to the county
Or
building.
just call him.
I haven't noticed.
Anyway, anything you can get me this week so I can send it out to the ambulance board
I will.
before the 18th, otherwise by the
Yeah.
18th.
Okay.
I'll work on
If there's nothing else, I'd entertain a motion to adjourn.
Second.
Motion, all in favor?
Aye.
Motion passed. Thank you very much.